Kenzie Barrett, and I'm going to do my postpartum head to toe assessment of my patient. Okay, so we'll start by coming into the room. Hi, Mom, how are you feeling? Good. I'm coming in to do an assessment of you, but before we get started, I'm going to wash my hands. Make sure that I'm doing good hand hygiene. Okay, Mom, before we get started, let's give baby to one of the family members. So let me have babies doing so good. We're going to put that over here. Okay. Now, can I see your wristband? I'm going to check it and verify it. Can you tell me your first and last name and date of birth? Okay, great. Before we get started, can you tell me how you're feeling? Are you having any pain right now? She may, depending on what type of birth she gave, if it was vaginal or C-section, she might have some of that pain or maybe just total body aches. So we would address that as needed. Okay, Mom. Let's first start by checking your vital signs. So I would take her blood pressure and I would check that. And I would expect it to be within normal limits unless she had preeclampsia. She might still have some elevated blood pressure after giving birth. Otherwise, I expect it within normal limits. Next, I would check her respiratory rate as I checked her pulse. Radial pulse would be fine. And again, I expect them to both be within normal limits. Okay, and then I would go ahead and check her temperature and make sure that that is within normal limits as well. So normal limit ranges are 120/80 for blood pressure. Heart rate could be from 60 to 100 beats per minute. Temperature, I expect it to be above 96.8, below 100.4. All of that would be expected normal findings for her at this point. Okay, Mom, but next let's go ahead. I'm going to check your heart sounds and your lung sounds. Let me clean my stethoscope first. And you know what? I'm going to put my gloves on real fast. Okay. So I'm just going to pull this back a little bit. And I'm going to start with her heart first, and I'm checking the normal signs that we would do for a health assessment. So your A, good. Your B, good. Atrial. And her heart sounds normal. Next, I would assess her lung sounds. So I would just have her take some nice deep breaths. Good. Okay, nice deep breath. Breath in and out. Very good, thank you. Now while we're at this point, I'm going to go ahead and listen to her bowel sounds. And I'm going to start in the lower right quadrant. So just keep breathing for me. Good. Good. while I'm getting her bowel sounds, I'm also checking skin, looking at any of those strider marks, the stretch marks, to see how they're healing, looking for any heavy bruising, bleeding going on, especially if she had a C-section, because we're right here at the abdominal area. I'm pulling back, just kind of visually seeing, making sure that everything is looking okay. There's no bleeding going on there. Looking for any redness, streaking, things like that. And it all looks good. Okay, since we're at this point, I would have mom sit up, and I'm going to listen to more breath sounds from the back side. So I'd have her take a nice deep breath. Good. Deep breath in. Good. Good job, mom. Keep going. Deep breath in and out. Good. Good. And her breath sounds are normal at this point. And while she's sitting up, I'm going to go ahead and do my CBA check. So I would palpate just right here on the low back. And I'm going to give a hit to see if it's tender. And we would know right away because she would jump. But she did good. She didn't have any tenderness going on. Okay, mom, we can lay back again. All right, so moving forward with the exam, the next thing I'm going to do is I'm going to check her uterus, because we're going bubble heave. Actually, I'm sorry, I'm going to check her breast first. So I would ask the patient, how is breastfeeding coming along? Is the baby attaching well? Are you having any pain or anything like that? How do you feel like your milk is coming in? Sometimes that takes a little while, up to 3 days. But we want to make sure baby is latching on good. So the next time the baby's hungry and you're feeding, if you don't mind to calm me down so I can come in and examine and make sure that we're latching on good and baby's getting enough milk from the breast and actually getting into a good spot where it's not causing you any pain or tenderness or breakdown of the nipple area. If you don't mind, I'm going to go ahead and just palpate and see what's going on. So I would examine skin color. Again, we're looking to see if the breasts are soft or more firm, if they're starting to fill up. Looking for those signs, looking for if there's any breaks in the skin or redness from latching on incorrectly, things like that. But the breast looks good. I would come back and examine again when she is breastfeeding just to verify that it looks good and that the baby is latching on correctly. Okay, so now we'll move into the uterus. And we want to find that. We're going to place one hand at the pubic symphysis because we want to stabilize the uterus. And right now, as long as she has gone to the bathroom and has an empty bladder, you can find it right above the umbilicus, the belly button. And I would palpate to see, and it's going to be firm. If it was deviated up higher to the right, then it means that mom might need to go to the bathroom. It means the bladder might be full, which we have not discussed that yet. But it's right here where it should be, and it's firm. So next I would ask my patient if she has been going to the bathroom, and we would like to collect the first 3 urines, the first 3 times that she goes to the bathroom, just to verify how much volume we're getting and make sure that there's no residual left in the bladder, that she's fully emptying, because sometimes with moms who get a spinal tap or different anesthesia, they might have some retention, some things going on with the bladder. So mom, make sure that you're peeing in the hat, and we'll collect the urine and make sure that you're clearing that amount so that we know that the bladder is fully emptying each time that you go to the bathroom, okay? Great. At the same time, whenever I was palpating her uterus, I would also look to see if any low key is coming out. That would be any type of blood clots. We want to get those out, of course. And so we're kind of at that point, I would be examining for that. So I would actually have mom roll onto her side. So I would ask the patient, okay, we're gonna roll onto your side so I can examine what's going on. Check to see if there's a little incision. Make sure that that looks good. And I'm gonna look and see if you have any hemorrhoids at this time. So I would have her lay on the side, have one leg over, and I would just take a look and examine, looking again for low key, looking for hemorrhoids, things like that, examining mom really well. Also making sure that there's no blood all over the bed or anything going on that's abnormal. This is a great time to look for that because you're actually moving them and seeing how the body's reacting to that as well. So I would have mom come back down. Everything looks good and looks normal at this time. While I'm here, I'm also gonna go ahead. So we did bladder, bowel movements. I checked those. I checked bowel sounds, the low key, bubble, heave. I know, well, what I want to do next is I'm going to check her legs for edema and swelling. So I would come down the legs here and I would just see if she has any pitting edema. Some patients might, if we've had a lot of fluid given to them through IV during their delivery, or preeclampsia patients could probably still have some edema in both legs. But this patient's within normal limits. She doesn't have any edema. I'm gonna go ahead and check, not really do a Holman sign, but kind of a Holman sign. I'm gonna see if there's any redness or tenderness in the calf for my patient on both sides. And we would of course want to get her up whenever we can and get her moving so that we can prevent those DVTs. Okay. Next, I have been checking mom's status since I've been in the room, just to make sure that she's not overly emotional. She might be, that's pretty normal too, but as in not really responding, not responding to the needs of her child or feeling really depressed. She is interacting with me and everything is going good. She's really excited about the baby. She's feeling good. Everything's looking normal. So I would be assessing those types of behaviors the whole time I'm interacting with the mom and the babies in the room and seeing how they interact with each other. Okay, so I'm going to grab my card to make sure that I didn't miss something. Okay, I think that is good, and we checked the skin as we went. Okay, so I would let mom know that everything is looking good. I would have the call light next to her. We would get the family to bring baby back and give baby back to mom. And then just remind her that when she's ready to breastfeed again, to give us a call so we can come down and make sure that baby's latching on really good. And I would just ask her if she has any questions. This can be pretty overwhelming for a new mom. So she might have some different questions of her own. And before I go, I will get rid of my gloves and wash my hands, and then just call me if you need me, okay? Thank you.